Helmet Man News. Like, subscribe, share, Patreon, merchandise. Oink. Let's see what's happening
Associate
now.
Commissioner. He's also president of the Center for Medicine in the Public Interest, Peter Pitts. Peter, thanks so much for joining us today. There's this race across the globe. This race across the globe to get to a vaccine. Hearing different, officials give us different numbers, different varying length of time at how far we are out from that. I guess the question that matters most to Americans is not when there will be a vaccine, but when there will be a vaccine that is approved for widespread use. What's your best guesstimate on that now?
There's a lot of good news here. Biotech companies are working with governments and regulatory agencies and academia all around the world to get this vaccine done, to get therapeutics invented. The FDA, for example, in the U.S. is working 24 hours a day, 7 days a week, really around the clock, making sure that experimental medicines are getting through the system, that existing medicines are getting what's called emergency use exemption, so that doctors have the tools they need to fight for those people who are the most ill, people in hospital, older people, people with pre-existing conditions. So we have things like chloroquine that is both undergoing solid scientific research as well as being used in clinic right now. Obviously, you can't base these things purely on anecdote. The plural of anecdote isn't data, but we're doing the right thing when it comes to testing. Again, similarly, whether it's testing that show positive or negative, or whether it's plasma antibody testing, those tests are being sped forward. But my guess relative to a vaccine is probably 10 months to a year. And for vaccines, that's pretty fast. So I think there's pretty solid cause for optimism.
Well, so now there's this race to a vaccine. You say that's 10 to 12 months out. And then there's also these antibody tests that you mentioned. We keep hearing a lot about them. Take a listen to Dr. Anthony Fauci a couple of days ago on these tests. I'll get your reaction on the other side.
Within a period of a week or so, we're going to have a rather large number of tests that are available. These antibody tests are tests that we do on other diseases, but they need to be validated. You need to make sure that they're consistent and that they're accurate. And that's what we're doing now, both with the NIH and with the FDA.
So unpack that a little bit for us. Talk to us in real speak about what this means for Americans.
Well, firstly, what Dr. Fauci is saying is you don't want tests approved that are inaccurate. You want to expedite but not rush. And that's what's happening right now. And that's a finesse. And it takes a team effort, both government and private industry, to make sure it's happening, and it is. But the importance of these antibody tests is it doesn't necessarily show whether you're positive or negative. It shows whether or not you've already had the disease. And that's important really for two main reasons. The first is that the blood plasma, the antibodies from people who have already come through to the other end of the tunnel, might give patients a bit of immunity. It might make the course of the disease a little easier to handle. Equally important, it'll give us an idea how many Americans have already had the disease. And that's a key data point relative to when we can reopen our economy.